I want you to take a deep breath in and out. Now imagine someone not being able to take a deep breath because of their health. And imagine the feeling of describing this to your health professional and not being heard, and all the negative consequences of that failure. This is called a health disparity. Hello, my name is Kendall Gathers, and I had the pleasure of interning with the Health Forward Foundation to answer the question, how can we reduce health disparities in Kansas City? The Health Forward Foundation is a nonprofit organization whose mission is to achieve health equity and secure a fair and just region through leadership, advocacy, and resources, and serve in areas such as people, power, place, and platform. According to the Kaiser Family Foundation, 18% of African Americans in the United States reported discrimination by a healthcare provider because of their race or ethnic background in the year of 2023. This discrimination may look like a healthcare provider denying certain medication or neglecting your health concerns. To understand the impact of health disparities in Kansas City, I conducted a survey about experiences of different health disparities. I sent my survey to people of color in the Kansas City area over the time period of 1 week. My survey received 100 responses, and out of those 100 responses, 47 participants have said that the lack of treatment created by the bird diseases as the health disparity that they've experienced. From my empathy work, I concluded that the problem with health disparities in the Kansas City area that needs to be addressed is the lack of education provided to Kansas City citizens. Although there are programs such as the Kansas City Health Equity, Learning, and Action Network to combat health disparities, people are educated on what is the best decision for them. In my ideating process, I thought that we could create a program to learn about health equity, but then I realized that the Kansas City Health Equity, Learning, and Action Network is doing the work for organizations. This organization partnered with local organizations to learn about inequalities and how they can be addressed through changes of systems and practices. Then I considered a council provided by the Health Forward Foundation, but that wouldn't work because they already have a community advisory board, which serves as a bridge between Health Forward and the communities that they serve. My solution to this problem is an educational platform created by the staff and technology team of Health Forward Foundation to allow those affected by health disparities, such as people of color, underserved communities, and people with disabilities, to engage in the healthcare and educate themselves. For those who do not have access to technology, a brochure is sent out to hospitals and health centers based on the basis of health disparities, how to spot them, and how to help others. These are made by the staff at Health Forward as well. This platform would provide information on factors such as genetics, community outcomes, and access to care contribute to health equity. This will also educate the historical components that relate to healthcare injustice, such as the Tuskegee syphilis study. This platform also provides questions to ask your healthcare provider during visits, allow users to explore organizations in the Kansas City area that achieve health equity, and provide resources to educate others. This platform should also provide information such as the common health disparities seen around the Kansas City area, how to notice racial bias, recognize if your treatment is best for you, and how to advocate for your health concerns. Currently, a platform to connect residents with all these resources does not exist elsewhere in the Kansas City area. Although the Kansas City Health Equity Learning and Action Network is similar, it partners with organizations rather than the people that they serve. While my solution will not completely solve the problem, it will be a big step towards reducing health disparities because it is educating the public outside of organizations. This platform will be created by the technology team and professional at Health Forward Foundation, and this project will take approximately 4 months to incorporate, starting in July of 2024 to October of 2024. In July, we would interview health professionals working in different backgrounds about their work on health disparities and reaching health equity. In August, we would aim to send the platform to community hospitals and health centers for increased outreach and connect to the IT team at Health Forward to activate the Health Equity Hub and run test trials. In September, we would submit rough and final drafts to communities in Kansas City and launch in October. The budget I'm requesting is only $2,500 for financial support to pay IT for the creation of this platform, and Health Forward already has much of the resources and infrastructure they need to create this. Thank you for your time.